everyone. So in the last video we treated smallpox. So in today's video we're going to treat another topic known as polio or poliomyelitis. So poliomyelitis, when looking at the overview, it is commonly called polio, and it is a contagious viral illness that is caused by the polio virus. So this polio virus, it affects the CNS, the central nervous system, particularly the spinal cord. So the disease is present in a wide range of forms, from mild illness with no symptoms to paralysis, and it can even lead to death. So this poliomyelitis, it mainly affects children between the age of 5, but non-immunized adults, they can also become infected with this condition. So the most serious complication of polio is permanent flaccid paralysis, which can affect the limbs and even the muscles, and even the muscles that control breathing and swallowing. So looking at the background of this condition known as polio, so polio has existed for thousands of years, and it was once a global epidemic disease, just like smallpox. And this was before the development of vaccines, and it's usually during those periods it caused widespread outbreaks, particularly in the early to mid 1900s. So this was before they discovered the polio vaccine, and it was very hard to control this condition during those times. So however, through intensive global immunization efforts, polio has been eliminated from many countries. Still, cases do occur, like in areas with poor vaccination, like parts of Asia and parts of Africa. So the disease is caused mainly by the polio virus, which is a type of enterovirus, and it is highly infectious, and it can be transmitted through primarily through the fecal oral route, meaning that it spreads when contaminated hands and foods or water come into contact with the mouth. So the virus replicates in the intestine, and it can invade the central nervous system, leading to nerve damage and leading to paralysis. So let's look at the signs and symptoms. So polio infection can be categorized into 4 clinical forms based on the severity. So we have first asymptomatic infection. This is known as subclinical polio. So it is seen in about 90% of cases, and it usually has, as the name implies, it usually doesn't have any visible symptoms, and infected individuals, they can still shed the virus and spread it to other people, so they are still contagious. Then we have the second clinical form. This is known as mild polio, or another name for it is abortive poliomyelitis. So here there are non-specific symptoms lasting a few days, such as fever, like non-specific symptoms like fever, tiredness, headache, nausea and vomiting, sore throat, abdominal pain. So it usually does not progress to neurological symptoms. Then when we're looking at the third clinical stage, here we have non-paralytic poliomyelitis, also known as aseptic meningitis. So here the symptoms include the symptoms listed in the second clinical stage, that is the non-specific symptoms like fever, tiredness, and also additionally it also includes like neck stiffness, pain in the back and the limbs, sensitivity to light, muscle spasms, and here no paralysis occurs and recovery is complete. Then we have the fourth clinical form, that is paralytic poliomyelitis. So this is the most severe form, and it occurs in less than 1% of infections. So less than 1%, that is very rare. And after initial symptoms, like the previous symptoms I mentioned, there will be sudden onset of flaccid muscle weakness, usually in the legs, loss of muscle tone, reduced or absent reflexes, muscle pain, muscle sensitivity. Paralysis is often asymmetric, like affecting one side more than the other. Then there will be no sensory loss, and if the respiratory muscles are involved here, it can lead to respiratory failure or it can lead to death. So there's a particular kind of polio that is called bulbar polio. So this bulbar polio, it may involve facial muscles, and it may involve swallowing and voice changes. So there will be effects in all these places. So when we're looking at clinical presentation, so a typical patient might present the following symptoms. So for example, a child under the age of 5 can present with fever and maybe sudden weakness in one particular leg, and then on examination, on further examination of this child, there could be presence of flaccid and soft muscle tone, weak or absent tendon reflexes, normal sensation, because the sensation is not affected. Then muscle wasting develops over time. So there would also be a notable history of incomplete or no immunization against polio. So in cases where the situation is more severe, it is involving the brainstem. So like I said, bulbar polio, this is polio that involves the brainstem. So there will be difficulty swallowing, difficulty speaking clearly because it will affect the voice box. Then shortness of breath, cyanosis, that is bluish lips due to low oxygen. So looking at the cause of this polio, so polio is caused by the polio virus, which is a type of enterovirus, and the virus is commonly is highly infectious, and it spreads by fecal oral transmission. That is when we take contaminated water, contaminated food, or contact with stool of an infected person. Then occasionally it can be spread through droplets from coughing or sneezing. So once this polio virus is in the body, it multiplies in the intestine, and it can enter the bloodstream to reach the central nervous system. So it specifically attacks the anterior horn cells in the spinal cord. So this is why in severe cases this polio causes paralysis, because it particularly attacks this spinal cord. And these anterior horn cells of the spinal cord, they are usually involved in controlling voluntary muscle movements. So looking at the risk factors, number one risk factor is not receiving the polio vaccine, like unvaccinated individuals that have not taken the polio vaccine. Then children below the age of 5 years, poor hygiene and sanitation, then living or traveling to regions where polio is still endemic, and then malnourished children too, because malnourished children have weakened immune systems. Then overcrowded and unhygienic living conditions too. All these are risk factors of getting this poliomyelitis. So when we're looking at the anatomy and the physiology of this polio virus, so polio virus, it primarily targets the motor neurons in the anterior horn of the spinal cord, and it may also involve the brain stem, particularly in bulbar polio. So there's usually damage to these motor neurons, which leads to muscle denervation, resulting in flaccid paralysis. So the virus does not particularly affect sensory nerves, so the sensation of the patient usually remains intact. So for the looking at the pathophysiology now, the virus enters the body through the mouth, so fecal oral transmission, and it replicates in the throat and the intestines. So from there it spreads to the local lymph nodes, and then it enters the bloodstream. So in some patients, the virus crosses into the central nervous system, particularly the spinal cord and the brain stem. So when it crosses into the spinal cord, the polio virus will attack the motor neurons, and it leads to muscle weakness, loss of voluntary movement, flaccid paralysis, and then in severe cases it can cause respiratory muscle failure and death. So once these motor neurons are destroyed, they do not regenerate, and because they do not regenerate once they are destroyed, it will then lead to permanent paralysis. So that's why most of the time when you see children that have this polio, most of the time they can't walk. It's due to this the damage of these motor neurons and the resulting permanent paralysis. So looking at the diagnosis, first, when we're looking at clinical diagnosis, so number one is sudden onset of flaccid paralysis, flaccid asymmetric paralysis in a previously well child, like a child that was well previously, all of a sudden has this condition of paralysis. Then absence of sensory changes, like I said, it does not affect the sensory neurons, so absence of sensory changes. Then history of poor or no immunization, and then recent exposure to someone with polio, or traveling to an endemic area where there's high prevalence of polio virus. Then for laboratory diagnosis, stool samples are usually taken. So the virus is isolated from the stool specimens within a few days of the symptom onset. Then throat swabs too are done, which may also show the virus, especially in the early stages. Then there's something called cerebrospinal fluid analysis, which may show increased white blood cells and proteins. Then PCR test too, that is polymerase chain reaction, can be used to detect the virus genetically, like the genetic makeup of the virus. So some other condition that could mimic the symptoms of this poliomyelitis, like for example other spinal cord injuries too, because other spinal cord injuries could also cause this paralysis. Then peripheral neuropathies, then also Guillain-Barré syndrome, which causes ascending paralysis. And here the difference here is that sensory symptoms are present. So here it affects the sensory nerves, unlike with polio virus. So looking at the management or the approach considerations for this condition, so there's no specific antiviral treatment for poliomyelitis. The management is supportive, and it aims to, number one, prevent breathing and swallowing function, preserve what am I saying? Preserve breathing and swallowing function. Then minimize long-term disability, and lastly, prevent secondary complications. So when we're looking at for example, during the acute phase of the infection, so hospital care is done for monitoring respiratory function, then mechanical ventilation too if the respiratory muscles are affected, then pain relief with analgesics is given, and looking at the impaired swallowing. So for this condition, intravenous fluids can be given if the swallowing is impaired. Then physical therapy and rehabilitation too is done to maintain the muscle flexibility and prevent contractures, that is, prevent muscle stiffness or joint stiffness. So using of orthopedic devices to like braces to support weakened limbs, just part of the physical therapy that could help in this condition. Then surgical correction too in some cases, like for example for some specific deformities, and then scoliosis too. So looking at another kind of support like psychosocial support, like emotional support for the patient, so that is also needed, and educational support is also needed for the children with that develop long-term disabilities. So usually prevention is better than cure. That's how they say it. Prevention is better than cure. So the main method for prevention of this poliomyelitis is vaccination. So there are two types of polio vaccines. There is the inactivated polio vaccine, which is a killed virus that is given by injection. Then we have the second type, oral polio vaccine, which is a live weakened virus given by mouth. So the vaccination is recommended for all infants and is part of the routine immunization schedules worldwide. Then other preventive measures besides the major one, which is vaccination, like good hand hygiene, drinking clean and safe water, proper sanitation and disposal of feces, then public health surveillance too for early detection and early containment. So looking at the prognosis of poliomyelitis, so most individuals, they recover fully if they do not develop paralysis. Then paralytic cases may result in permanent limb weakness, joint deformities, breathing difficulties. Then post-polio syndrome may also occur decades later with new or worsening muscle weakness, fatigue, muscle and joint pain, and death can occur in severe cases involving the respiratory or other muscles. So basically, individuals that have this polio, if the extent of their polio has not reached the severe like if the severity of their condition has not reached the, like I said, there are 4 clinical forms. So if they've not reached like the last stage where there's like the paralysis is involved, they usually have the chance to recover fully. But when paralytic cases start coming up, there could be permanent damage, permanent joint damage, permanent muscle damage, and in these cases things become more complicated. So the best thing to do is just make sure you are properly vaccinated, make sure you have a very good hygiene to prevent all these complications. And yes, that is basically it. Thank you for being here with me in another video. Bye.